Hi everyone, this is Lady T from In My Own Words, my thought of the day. And my thoughts today are centered around childhood trauma. I watched a piece via YouTube that Oprah Winfrey did on 60 Minutes this past Sunday, and it struck a chord for me. She interviewed a place in Milwaukee that takes helps children that have been orphaned for some reason or another. That's how the actual institution started out there. But now they help disenfranchised, impoverished communities to help the children there that have had trauma to learn how to deal with it and to grow and develop into being productive people as adults. And she talked to a Dr. Bruce Perry, and he's the leading expert on childhood trauma. As a matter of fact, he's spoken all over the world, and he has a, PhD in physiological. He's a neuroscience person, and also he has been educated with childhood trauma. So he's an educator as well and a clinician. And so a lot of the things that he talked about really resonated with me, having worked in the mental health system with children and worked in the public school system with children, being a professional mental health provider. I've seen over and over again, and even in my own personal life, have had those traumatic experiences, and they do shape the person that you become as an adult. So I'm going to do a series starting now with what are the signs of childhood trauma and how do we combat or be proactive or even work with someone that you see, some child that's in your community, that's in your sphere of influence, of someone who's connected to you in some way. How do you notice the signs, and how do you help that child become better? Now, you may not be able to be hands on, but maybe you can become educated and then pass on that information to someone who is close to that child. We all have seen what trauma can do, and I just want to read what the dictionary says trauma is so we can have an understanding. Trauma is a deeply distressing or disturbing experience. It could be the death of a child, but in this case, we're talking about children with trauma. And trauma, it can affect a child in such a way that it prevents them from growing, quote unquote, normally, or what we determine to be normal. And why am I so interested in this? Well, I've been interested in this for many years. I went to school for psychology, and then I had the master's, as I told you in earlier posts, in mental health counseling. So, as I was working in these different fields, working first in the public school system as a substitute teacher, and then working as a behavior specialist, I went on to work in a hospital doing the same thing, educating young children, working with them, children who had behavior issues, children who had emotional issues, who were on psychotropic medications. So I do know a lot about this particular topic, and I wanted to share with everyone because, again, it is something that's on my heart, and it has been for many years. One of the observations I made when I was working, first of all, in a public school system was the lack of mental health professionals. They have nurses and they have school social workers, but they didn't have, unless you were in a self contained classroom at that time. Now they don't have self contained classrooms anymore, but at the time they did. And then they would take the children out for resource room. And I worked with a group of students that had behavior issues as well as they had developmental issues. And the difference between the two, or should I say, how they're interrelated, is a child who has a developmental issue in their academics would be lacking in their math and English, their language. They would have sometimes speech impediments, or they would have difficulty understanding, comprehension skills would not be where they should be for the level of grade that they were in. And as a result, their behavior would reflect that. And so that's how oftentimes educators, because they do have general training, they would find out, okay, this child is having some sort of issues because they're having behavior problems. And a lot of times that is how it is identified with those children. And so I saw that even though they had some resources and they had support, the people who were supporting them, sometimes, not always, but sometimes, it has been my experience that they were inadequate. And what do I mean by inadequate? They were ill equipped to provide what that particular child or children needed. And that bothered me greatly. So whenever I was in the classroom performing the service, the academics with those children who were identified, I would have in a small group. So whether it be math class, language arts, whatever the class, history, whatever it might be, I would be the person sitting with them in the back of the class, giving them the lesson according to their understanding. And again, behavior would show up. Abnormal behavior would show up. Some of them would curse. I had some 12, 13, and 14-year-olds. And I have worked with children that are definitely younger. But in that particular group, the behavior was just unseemingly, it seemed, but nobody was addressing the trauma in the child. They were giving them reading support, giving them math support, giving them the academic support, but they needed the psychological support. And that was the part that bothered me. And of course, being the behavior specialist, I had some insight, but not as much as I do now. And so that's why I'm coming on to educate you all on my YouTube channel. I want you to be educated. I want you to know what childhood trauma looks like, how to identify it, how to be a person who is helping to combat it, to be proactive in it. And again, if you know a child that suffers, you'll know it because the signs are evident in a child. If you come into contact with a child who cannot sit still, who's up and moving, and then when they're being redirected, they're combative. It's difficult for them to be redirected. That's a source of trauma. That is a sign that that particular child has had some source of trauma. Now, I want to get into what trauma is, the signs, what we deem it to be, what I've seen, and talk a little bit in more detail. But I don't want to be too long in this post, so I'm going to do a series of posts. But I wanted to give you an introduction, and we'll talk it down. I'm going to break it down definitely, so we can, so you can see. And you don't have to be an educator. You don't have to be a mental health professional or doctor or anything of that nature. You just have to have a heart and pay attention to the signs. And this is general information for anyone to understand. And I'm trying to make it as simplistic as possible. So I'm going to come back and do another post right after this one, and we'll talk some more about it. All right, everyone. This is Lady T, and this is in my own words, my thought of the day. And this is part 1 of childhood trauma. And as I often say, make your day great, live your life on purpose. I'm living my life on purpose by giving you this information and hope that it'll be helpful to you if you see someone who has had a traumatic experience as a child now, and what you can do to be a great help to them. All right, take care. I'll talk to you all soon.